Hi friends, welcome back to my YouTube channel Pratibha's Nature Delight. So in today's topic is fissure in ano. I will explain you in details of fissure in ano, the definition, the causes of fissure in ano, the types of fissure in ano and the proper treatment of fissure in ano. So let's get started. Starting with these are the parts of the chronic fissure in ano. This is the fissure in ano. This one is the sentinel pile, and this other one is the hypertrophied anal papilla chronic fissure. And here you can see I have drawn this one is the rectum, this one is the anal canal, and these are the anal valves. Next, coming to what are the features of chronic or acute fissure in ano. It is common in middle-aged women, not in elderly. Pain is severe in acute condition and less severe in chronic condition. Constipation, bleeding and discharge per rectal examination and proctoscopy not possible in acute fissure in ano. In chronic fissure, ulcer felt with button-like depression, induration and sentinel pile. What are the differential diagnoses? It can be carcinoma anal canal, it can be inflammatory bowel disease, it can be venereal disease. Starting with the treatment of fissure in ano, general measures should be taken like adequate fluid intake, 6 to 8 glasses of liquid, fiber-rich diet, bulk forming agents that is psyllium husk, stool softeners, local agents, anesthetic agents like lignocaine, Sitzbad, avoid constipation. In acute case, stretching of anal sphincter using 2 fingers of each hand, 4 fingers under anesthesia. In Lord's dilatation under GA to relax the sphincter, using 4 fingers of each hand, that is 8 fingers, laxative silocaine surface anesthesia application. In chronic fissure in ano, fissurectomy with sphincterotomy under anesthesia is done. Here, transverse fibers of internal sphincter is divided in the floor of the fissure. So what is lateral anal sphincterotomy? This is the main line of treatment for fissure in ano. Here the internal sphincter is divided partially away from fissure either in right or left lateral position. Closed or open method is used. Sphincterotomy done below the dentate line. In closed method, number 1 blade is inserted into the intersphincteric groove to pass upwards. Blade moved medially to cut lower 1/3 or half of internal sphincter. In open method, skin is incised laterally external to the anal verge. Hypertrophied band of lower part of internal sphincter dissected and divided, and wound is left open. So topical nitroglycerin can be used 0.2%, also used to relax the sphincter. Then botulinum toxin 25 unit is injected into the internal sphincter, causes temporary denervation of internal sphincter, reducing tone, improving blood supply and control ischemia. Anal advancement flap is more effective in females. So in case of fissure in ano or in any perineal surgery, lithotomy position is used in case of fissure, in case of piles, in case of fistula or in case of anterior perineal resection. So here I have explained in short about the sentinel piles. What do we mean by a sentinel pile? Like here we studied, like in chronic fissure condition, we see sentinel piles. So what is sentinel pile? Sentinel means guard, commonly associated with fissure in ano of chronic type. In lower part of fissure, skin enlarges and appears like guarding the fissure. Can cause perianal hematoma, abscess, discomfort. Chronic fissure treated with excision of sentinel pile, low grade infection and lymphatic edema. So friends, in today's video I have explained you in details the treatment of fissure in ano. So friends, hope you liked my video. Like, share and subscribe to my channel friends, and do comment in my comment section. Till then, bye bye.